Hello, everybody. Greetings from IJCP Group and Med Talks. I'm Dr. K.K. Agarwal, President, Confederation of Medical Association of Asia and Oceania. I welcome all of you in today's webinar, and that has become very important to understand. But before that, let me introduce my faculty. I have with me Dr. Suryakant Tripathi, a close friend. He is a professor and head of Department of Respiratory Medicine at King George Medical University, Lucknow. He is also the member of Special Task Force for Corona Control, KGMU, Lucknow, President, Indian College of Allergy, Asthma and Applied Immunology, and President of National College of Chest Physicians, India in 2019-20. Welcome, Dr. Suryakant.
Yes, sir.
I have also with me Dr. Papa Rao Nadakuduru. Sorry.
Good evening, sir.
He is a senior consultant physician at KIMS Hospital, Hyderabad. So welcome to our discussion.
Thank you, sir.
With me, Dr. Benny PV, a professor at Shri Gokulam Medical College and director of Ashirvad Mission Hospital, Trivandrum.
Good evening, sir.
Welcome with us. And we also have, thank you for joining us. Now, why this subject has become important today, that is Ivermectin, for certain reasons. Plasma therapy came, ICMR said no effect. Hydroxychloroquine came, Solidarity trial says bye-bye. Remdesivir came with a big bang. Solidarity trial says, sorry, you are not allowed to enter my body. Trump created history by taking an antibody, by a monoclonal antibody. Lilly says, sorry, I'm halting the trial. The Oxford vaccine says that I'm ready to come. I am just ready to be launched. And suddenly 2 patients develop transverse myelitis. UK, India, South Africa, Brazil said we'll continue with the vaccine. USA says, sorry, I'm not going to continue with the vaccine. I'm not sure about its effectiveness. Then came the Johnson & Johnson vaccine. They say mysterious illness. We are withholding the virus, the vaccine. Then came the vaccine, which is a messenger RNA, both Moderna and of Pfizer. And patient said on the second infection, the patient developed severe chills. And with one of the vaccine, the patient broke upon his tooth. So everywhere we are in a dilemma, what to do, what not to do. Every trial, every medicine. So we are going back to basics. The first basic is masking, which there is no dispute that masking prevents. Second thing which is coming up is Ivermectin, query role, cheaper drug available everywhere. Why not use Ivermectin? And the third is undisputed steroids. Early steroids, along with an anticoagulation, saves life. So when it comes to treatment, today we know that steroids and oral anticoagulations are inevitable. But what about prevention? What about adjuvant? What about add-on? One of the drugs still remains in debate with some convincing evidence now is Ivermectin. Today in India, there are 2 states who have adopted it. Many medical associations are talking in its favor. And today's topic is to discuss everything about Ivermectin with all my colleagues sitting here. I'll start with Dr. Suryakant. You have done an extensive study and you were instrumental in bringing it to the UP protocol. Can you initiate the discussion? Dr. Suryakant.
Thank you, sir. Very good evening to all of you. Sir, host disabled participant is screen sharing. So can you permit sir for screen sharing
to everybody? Ritu, सबको allow कर दीजिए.
So thank you very much, sir, to this beautiful venture, I would say. And this is my second, of course, interaction on this platform. And I'm really thankful he was the national president. A lot of activities. Rather, first time the doctors of India woke up, and first time they started agitating, first time they raised their voice for their rights, and that was the initiative of Dr. K.K. Agarwal. And I'm personally blessed when he, of course, gave me honor of appointing me as IMA honorary professor. So I'm really thankful, Dr. K.K. Agarwal. And of course, since 2017, I'm continuously being blessed by him. And now I'm closely associated with the
आपकी आवाज में कुछ दिक्कत आ रही है? Can you change your internet, Surya? जब तक सूर्यकांत का आता है, let's start. Benny, start sharing some of your observations till Suryakant comes back. Dr. Benny PV.
1 second, sir. Hello, sir.
Yes, go ahead. Yes, he has come back. Let's see whether he is.
Yeah, actually, my there was network problem. Am I audible now?
Yes, you're audible now.
Okay.
Yes, go ahead.
Yeah. Should I start?
Yes.
Okay. Thank you, sir. So coming to the Ivermectin, so there is continuous sustainable, focus on the Ivermectin, not only from the academic world, this is also from the bureaucracy, politics, and of course the media also. So I'm coming. There are some slides which may be repetition of my older presentation, but anyway, I will rush through it. You know, this is the beautiful appearance of the virus COVID-19, but it is not beautiful. Virus is very harmful, very dangerous. And this appearance, it is just because of its appearance. In Latin, corona means crown, and this virus has crown-shaped appearance. That's why it is called, of course, coronavirus. And this is the viability period of virus on different surfaces. This is, again, I've already mentioned. So be aware that it can survive on various surfaces. So not only at the right time when you are there, it can survive. For example, somebody has a sneeze or cough in a room. So this virus can survive in the aerosol form up to 8 hours. So this is the updated data which Dr. K.K. Agarwal used to give in the morning. So if you see the around 4 crore people, they have been infected with this virus, and more than 11 lakhs death, they have been reported by WHO till date throughout the world. More than 200 countries are, of course, involved by this disease process. And India is just behind. I think my projection is that by Dussehra on 25th October, we will cross the United States of America, and we would be ranking first as far as the global ranking of cases infected by COVID-19 is concerned. So I used to say in Hindi कि कोरोना फैलता है 3 तरीके से, संक्रमित व्यक्ति से, संक्रमित वायु से और संक्रमित वस्तु से. तो तीनों चीजों से, इसीलिए सर ने कहा कि मास्क लगाते रहिए, हाथ धोते रहिए और शारीरिक दूरी बनाए रहिए. So these are the 3 important, of course, sutras for prevention. Incubation period is between 2 to 14 days, usually 5 days. In India, if you see the spectrum of activity, then around, I would say 50% are asymptomatic and 50% symptomatic. Globally, this ratio is 25-75, but in India, it is now said that it is 50-50. 50% are symptomatic and 50% asymptomatic. Symptomatic patient may present with mild, moderate, or critical illness. And common clinical features, the fever is the most common. Others are very rare, but this is the change of season. And during this season, you have common cold also, you have flu also, and coronavirus also. So every sneeze or every running of nose is not COVID virus. As since 9 months, last 9 months, I used to say in Hindi, जैसे हर चमकती चीज सोना नहीं होती, वैसे हर टपकती हुई नाक कोरोना नहीं होती. So we have to differentiate. The public has to differentiate, community has to differentiate, as well as the fraternity has to differentiate that which patient fitting into the classical picture of COVID-19. And fever, dry cough, and difficulty breathing. These are the three triad of symptoms which are very popular, other than the new upcoming symptoms, that is loss of taste and loss of smell, which are present usually in asymptomatic or mild cases. And this is the 28 days timeline. I have already discussed last time presentation. This I used to say corona journey of 28 days. Usually patient becomes non-infected after 28 days, but maximum 3 months is the timeline. But usually after 28 days, even you cannot detect the antigen. So this is usually negative also, and of course in non-infective also. And these are the complications which we used to face in the severe form. Usually level 3 hospitals are meant throughout the country for tackling these complicated patient, critically ill patient. Usually 2 important respiratory complications, the pneumonia and ARDS. And non-respiratory complications can be septic shock, acute kidney injury, DIC, rhabdomyolysis, and acute cardiac injury. May be presented by fulminant myocarditis and arrhythmia also. And diagnosis, as you know, that 2 samples are being taken by naropharyngeal swab and oropharyngeal swab. And of course, the choice of the test, the gold standard is the real-time PCR. Turnaround time is 4 to 5 hours, but usually 24 hours. But in King George Medical University, we are doing maximum number of course, COVID testing in the country. Our capacity is 5,000 tests per day, day and night, 24/7. The microbiology lab is running. And at the cost of everything, even had a department of microbiology, she not only got positive, but she hospitalized and then discharged successfully after the treatment. So we are doing a lot of contribution in the management in Uttar Pradesh as far as our institution, our pioneer institution. Other tests, they are the TrueNet test and antibody test, antigen test, but they are of course antibody meant only for the surveillance, and antigen test is only for the rapid testing. And this table is very important, that if you see the RNA PCR testing is 67, the sensitivity is around 67. So even 30% cases you can miss. And that's why a lot of role of HRCT thorax is coming up. Clinical picture mixed with the HRCT picture. Now this has become a very important tool for the early diagnosis of COVID-19. So this table also shows that you can miss the 30% cases if you rely only on the RT-PCR. And RT-PCR is a very important test during the first week. And of course, in the last week, in the last days of infection from 2 weeks onwards, the antibodies are the important test. A lot of treatment, as the opening remarks, Dr. K.K. Agarwal has already described the fate and the future of various kind of therapies, the plasma therapy and so many therapies, even therapy recommended by Ayush. This has been approved by Government of India. That is also being done. And people are now fed up with even remdesivir. A lot of first fed up with hydroxychloroquine and then fed up with remdesivir. So of course, the only hope left, as Dr. K.K. Agarwal has mentioned, the ivermectin and steroids. Early diagnosis, ivermectin, a lot of prevention, steroids, oxygen. So these are the only hopes. So this is the ivermectin story from soil to worms and beyond. So this was the late 1970s when Satoshi Omura, a microbiologist, discovered ivermectin solely from a single microorganism isolated at the Kitseto Institute, Tokyo, Japan, from Japanese soil. And then, of course, he contracted to the William Campbell, collaborated at Merck Research Labs in New Jersey, USA. He tested their effect against parasitic worms and then becomes a wonderful, very popular anti-worm, anti-parasitic drug. And in 1981, first introduced commercially for this huge, and last 40 years, this drug is well known for its important success for two important diseases. One is called river blindness, second is called the filariasis. And for the success story of these two two parasitic diseases, these two scientists were awarded Nobel Prize in 2015. So that is the success story of this drug as anti-helminthic. That's why it is called the wonder drug, but this has got antiviral effect also, anti-cancerous effect also, and immunomodulator effect also. So these are the four types of effect which you, of course, you can see in ivermectin, and that's why it is called wonder drug. Certain known facts about the ivermectin are that it is commercialized since 1981, low cost, as Dr. K.K. Arabal mentioned in his open remarks. So that's why it is the drug of attraction, especially for the developing countries like India. High efficacy and safety. Of course, it may be debatable, but I personally believe, and I think most of us now started believing. So this is included in 21st WHO list of essential medicine in 2019. So even WHO recognizes this drug. Easy availability, that's also. When we started, you see, when the GO of the Uttar Pradesh government issued on 6th August 2020, for a week or two, there was a crisis in the market. So, but now, slowly and slowly, the various pharmaceuticals, I think more than 20 pharmaceuticals now formulating the ivermectin, and they are supplying very effectively. So now it's freely available, at least in Uttar Pradesh, no problem. And most important thing is that no resistance to this drug, or this resistance is very much, of course, safe as far as the development of resistance is concerned. It is called wonder drug because it has been used for so many, of course, parasitic infestations. FDA approved broad spectrum anti-parasitic agent and effective against so many parasitic infestations. And of course, the mechanism is still, you see, debatable, but you can see on the right side of this slide that antiviral action, it is active from Zika virus to influenza to so many viruses, including HIV. And of course, that's why coronavirus also, and a lot of mechanism of action from cell wall entry to nucleus entry to multiplication to ionophore effect. So many things are of so many mechanism of action now coming up. The important mechanism is the inhibition of viral replication, as I discussed last time. The second is the blockade of the entry of the virus into the host cell. Third is the action as ionophore molecule. It binds to metal cations like zinc and form these lipid-soluble complexes that facilitate their transport across cellular membranes, profoundly deregulating osmosis and direct cytotoxic effect, killing the cell. So that's why it is usually given with zinc also. And another mechanism is the prevention of microvascular thrombosis. You have heard a lot of story about the thrombosis, that after the cytokine storm, a lot of microthrombi formation occurs, and that leads to a lot of complications where ACE2 receptors are found profoundly, for example, in lungs, in upper airway, inside the brain, inside the kidney. And that's why you have a multi-organ dysfunction syndrome, because these ACE2 receptors are very much prevalent in these vital organs, and a lot of microthrombi formation occurs, and this prevent the formation of microvascular thrombi, and that's why it is also important in prevention of complications. And another important is the sequestration in the pulmonary tissue. It is said, as compared to the serum level, it is 3 times more, of course, in the pulmonary tissue. Pulmonary, of course, lung has got maximum number of ACE2 receptors, and that's why lung is the usual target site for COVID-19, and this is why this is very important that it has got 3 times more concentration inside the lung, and it has also got the longest residence time, a long residence time inside the lung. It is said that it can reside in the lung with effective concentration up to 1 month, 30 days. So that's the story of the mechanism of action of ivermectin, which is still we are learning. Everybody is learning. New and newer things are coming up by in vivo study and in vitro study, and that's why we are updating ourselves. This is the dosage story, very interesting, that below 2 years and below 15 kg. So this drug has got wide, of course, spectrum. you can use from pediatric to geriatric population. That's wonderful. So below 2 years and below 15 kg, you cannot use. Otherwise, you can use from pediatric to geriatric, no problem. And the doses is still, I'll just show you in few slides that one study is going on AIMS Delhi, where doses 12 milligram per day to 120 milligram per day, the 5 doses schedule are being, trial is going on. So I think those may be debatable and later on those may be decided, but till date, the consensus is on that up to 15 to 30 kg, 6 milligram per day, from 31 to 60 kilogram, 12 milligram per day, 61 to 90 kg, 18 milligram per day, and more than 90 kg, 24 milligram per day. It is usually given 2 hours after meals, and avoid citrus juice, milk, and alcohol with this dose. Careful in liver diseases and seizure disorder. So if patient is on anti-epileptic therapy or having the history of seizure disorder, this drug should be avoided. Contraindicated in pregnancy, nursing mothers below 2 years, and it should also be avoided in, of course, severe spasm, severe bronchospasm, that is in severe asthma, uncontrolled asthma. It should also be avoided. Adverse effect, very safe drug. However, we can get the asthenia, abdominal pain, anorexia, diarrhea, nausea and vomiting, dizziness, pruritus, somnolence, constipation, tremors, etc. Rarely we can get some neurological side effect. That's why it is contraindicated in patients who are having some neurological problem or epileptic problem, or they are on anti-epileptic drug. So some neurological, but the most interesting thing is that ivermectin can be used safely even with 10 times of usual dose. So that is the interesting story. That is the safety profile, wonderful safety profile, which of course we are getting with this drug. Contraindications, as I mentioned, seizure disorder for pregnant women, women who are breastfeeding children less than 2 years, and it should be used with caution in severe asthma and severe liver disease. When I say severe liver disease, means the enzymes SGOT and SCPG are raised at least 5 times of normal. Very interestingly, this drug, of course, can be used. Somebody is waiting to enter, to log in. Please enter, Dr. Richa Tyagi. She wants to log in. This is coming on my screen. So it can be used in combinations also. A wonderful combination is ivermectin and doxycycline because of the synergistic effect. I have already told last time also the beauty of this synergistic effect. So the uses of ivermectin and doxycycline combination is a good choice in prevention and management of COVID-19. It can a wonderful combination that has been very popular in Australia. That is ivermectin, doxycycline, and triple drug therapy. I think everybody has gone a few weeks before in the media that this is the wonder triple drug therapy going on in Australia, possibly due to the following actions: inhibition of the spike ACE2 and thereby blocking the virus entry, chelation of the zinc and immunomodulatory property, and inhibition of the viral RNA replication within the host cell. It can also be given in combination with SCQS, but I want to share my KGMU experience of hydrochloroquine. Rather, we have sent a paper also on this. When we use this as a prophylactic drug in the healthcare workers of King George Medical University, our university is having more than 2,000 doctors, including the senior doctors around 500 and junior doctors around 1,500. And of course, I think please unmute who are login. Yes. So I think we have 10,000 employees, and when we use this drug, this hydroxychloroquine as a prophylactic drug, 17%, 17% reported some or other side effect. Hydroxychloroquine has got limitation that you cannot use in the cardiac patient, and of course, close cardiac monitoring should be done. So that's why usually we don't now that days have come, and usually people avoid hydroxychloroquine and its combination with ivermectin also. Now, there are certain published studies which, of course, demonstrate the safety profile, the efficacy profile of ivermectin. One such very popular study is called ICON study. In this ICON study, The primary outcome was the all-cause in hospital mortality, and secondary outcomes were the subgroup mortality and extubation rate and length of hospital stay. And this found the lower mortality in ivermectin group, 15% versus 25%. Mortality rate was also lower among the 75 patients with severe pulmonary disease treated with ivermectin. And of course, considerable difference in successful extubation rates also, 36% versus 15%, and length of hospital stay not affected. And ivermectin was associated with a significant lower hazard ratio for mortality. The another study, this was the randomized controlled trial involving mild to moderate degree of COVID-19 patient, and the treatment outcome were evaluated on 5th day in case of asymptomatic patient and 2nd day non-symptomatic day. This is from Bangladesh, and this online result published shows that by 5th day, 55% and 23% of patients in group A and B respectively gained symptomatic recovery, so better recovery in cases of ivermectin group. This was head-to-head comparison between the two groups, ivermectin versus the other group, and adverse event also lesser with ivermectin. Another study, this was the International Multicentric Observation Case Control Study, and that shows the outcomes as a proportion of patients that died in the ivermectin group compared with the propensity matched control cohort. So this resulted into the of those requiring mechanical ventilation, fewer patients died in the ivermectin group, and overall death rates were lower with ivermectin. So after these few published studies, whether online or offline, then of course I'm going through just having glimpses of ongoing clinical trials. So India has got around 8 trials. I'm talking of first the AIMS New Delhi trial. This is going on. The 5 doses in one arm, 12 milligram, second 24, 48, 96, 120 milligram. So 5 type of doses they are being under trial in AIMS Delhi, and a lot of other studies. One study is on prophylaxis, that is in RD Medical College Ujjain, assessed to efficacy of ivermectin as a prophylaxis of COVID-19 among healthcare workers and COVID-19 in Ujjain, India. So that's also going on. And this is the status of the global worldwide clinical trials which are going on throughout the world. And at least about 40 trials going on, including therapeutic and prophylactic aspect. So we are under review of the doing this prophylactic aspect also, and probably next time I will discuss purely on the prophylactic aspect. And of course, this is the GEO which Dr. K.K. Agarwal was talking of. The GEO was issued on 6th August 2020. And of course, I was the external expert from, other than the internal expert of the UP government, I was the external expert. And this, of course, we submitted our report on. We submitted our report on 4th August, and you see how promptly the UP government issued the GEO within 48 hours. The GEO was released on 6th August. And this is of 2 types. The GEO has got the prophylactic use as well as the treatment group. For prophylaxis, day 1, day 7, and day 30, and once a month, this is the 12 milligram OD for healthcare workers. And day 1, day 7, 12 milligram OD for household contacts. The treatment purposes, 12 milligram OD for 3 days, along with the tablet doxycycline 100 milligram for 5 days. And the doses can be modified as per the milligram per kg body weight, as I have already discussed during the dosing schedule as per the weight. So this is the latest Assam government protocol that also incorporate the zinc, vitamin C, vitamin D, famotidine. This is the supportive treatment, and the ivermectin also. So this is ivermectin 12 milligram twice daily for 5 days along with the doxycycline. So now this has become the usual combination, ivermectin and doxycycline. They have not prescribed for the prophylaxis purpose, but they have given for the therapeutic purpose. And the third government, this is the West Bengal government. This is on September, they issued, yes, for the treatment of mild to moderate COVID-19 case, and a combination regimen of ivermectin and doxycycline can be used. So they have also introduced the same type of repetition of GEO as the Assam government. So now the 3 governments, they are using the ivermectin. So that is the success story of the ivermectin in India. So this, we should be proud of that. India has taken the lead to use ivermectin, and UP had become the first state to use ivermectin. And now slowly the things are geared up, and of course other states are all following the Uttar Pradesh. This was the 18 experts of in India. We, of course, sat on repeated webinars, and then we formulated a white paper on ivermectin, and we published a white paper on ivermectin as a potential therapy for COVID-19. And of course, we should be proud of that through Science Direct, WHO also taking the cognizance, and of course on website they display this white paper. And of course, our latest publication on ivermectin published in IJCP, Indian Journal of Clinical Practice, in October, latest issue, October issue. So this is our latest review article. If you really want to have a overview of ivermectin, you please just go through this article. If you are not getting it, you just ask Dr. K.K. Agarwal, who happens to be the chief editor and of course co-author in this group. So myself and Dr. Harsh Rastogi from Apollo Hospital, and Jyoti is my senior resident, and Dr. K.K. Agarwal sir, we are the co-authors in this. And I would recommend you people that if you really want to have the overview of the ivermectin, then of course, please go through this review article published in the latest issue of October 2020. And this is the Times of India news, 16th October. You see, I surprised when the media got this attraction about the ivermectin. So now it is saying that is still Dr. Richa Tyagi waiting room, please admit her. Yeah. So ivermectin is India's new SCQ against COVID-19, but I pray God that the fate of the ivermectin should be, of course, wonderful. It should not happen like hydroxychloroquine. So we of course anticipate that it will prove a wonderful drug. So with this updated media news on 16th October, I think the atmosphere, the kind of perception, society perception, media perception, public perception, this is increasing the faith, the kind of confidence, the kind of belief. This is the increasing about the ivermectin.
So,
yeah. So, word about ivermectin, COVID-19 impact on healthcare workers. Whenever I speak on IMF forum or any forum, my chest forum or IMF forum, or my, of course, physician forum, I used to say that please protect yourself. So healthcare workers are very precious. So a little 2-3 slides about the COVID-19 impact on healthcare workers. And you know that this data given by Dr. K.K. Agarwal only, that death rate per million by COVID-19 in India in general population is 48 per 10 lakh, while in doctors it is 373 per 10 lakhs. So very high. And that's why I wrote an article. This is published in September issue of JIMA, Journal of Indian Medical Association, which is the most widely circulated journal of the India. So this is you can go through this. This is the online journal. You can go just access. This is access freely. And you can again go through this article, COVID-19 impact on healthcare workers, in which I have tried to put all kinds of dimensions regarding the health impact on healthcare workers, that is mostly doctors. So I would advise that please go through this article. And you will be surprised to know the most common group of the healthcare workers affected by the COVID-19 are the general practitioners, or those who are practicing in emergency room. And second is the, of course, respiratory physicians. Till date, data which I have gathered, till date about 550 doctors have died of COVID-19. Dr. K.K. Agarwal may correct me if I'm wrong, but this is the updated data according to me, which I gathered, of course, the compiled data. And a lot of other problems were faced by the healthcare workers during the pandemic. And we have to discuss this, we have to project it, we have to project to the public, we have to project to the media, we have to project to the government that these problems we faced. And we have already, the IMA have already requested that, that the government should declare all doctors, all healthcare workers died of COVID-19 as a martyrs. So shortage of personal protective, we did work, we did our job, even with the shortage of personal protective equipments, long working hours, violence against healthcare workers, increased risk of infection, and social and family impacts. All we faced, still we work. So a little bit about the prevention of COVID-19, as Of course, we are about 6 months ahead of we can get the vaccine. And as Dr. Harshvardhan has mentioned, that till July, our target is to vaccinate the 50 crore population, but India's population is 138 crore. So it is not one night and one day that, of course, in 24 hours or 48 hours, everybody will be vaccinated. No. And we don't know what will be the efficacy of the vaccine. So till we are getting any effective vaccine and all of the population get vaccinated, prevention is the only vaccine, as Dr. K.K. Agarwal has mentioned, and always grow. So prevention of COVID-19 package, of course, the Namaste has become a global brand. So don't forget Namaste, and please continue Namaste. We just forget Namaste. COVID-19 reminded us Namaste. Please continue our Indian heritage Namaste. Physical distancing. I used to avoid term social distancing. And shoe chappals, they should be taken off at the entry of the house. Hand wash repeatedly. Wear the mask when out of home. Diet and nutrition, I used to say, अगर immunity बढ़ानी है तो अपने बच्चे को ask him to become the vegetable child, not the burger child. Immunity, of course, you can attain by meditation, yoga, exercise, good sleep, and with no addiction. And of course, sanskar, respect and care of senior, passionate environment at home. Just also create a, of course, a kind of different immunity to all family members at home. Work from home and work of home, very important. If you are doing work from home, then of course you should also indulge in work of home. Teleconsultation, yes, this is the time of teleconsultation. More and more teleconsultation should be done to, of course, avoid the contact with COVID-19. Appropriate measures for airborne infection control at clinics and hospitals. PPE kit and N95 masks during the procedures. This should also be used at appropriate places. So our Prime Minister is personally concerned with this. He started with Jan Jagran. You see, when he advised for Tali and Thali, Deepak jalao, ye karo, wo karo, तो लोग हंसते थे कि साहब ताली बजाने से कोरोना चला जाएगा. ताली बजाने से कोरोना ही चला जाएगा. It's a kind of public awareness. So he has initiated Jan Jagran, and now he has launched a Jan Andolan. And what this Jan Andolan was launched on 8th October. And you see the we are also doing, this is the picture from our department at King George Medical University performing the yoga. And there are some tips for the stay healthy, the be active, eat healthy, don't smoke, don't drink alcohol, meditate, read books, listen music, soothing music. And in a nutshell, ivermectin exerts broad spectrum antiviral activity against several animals and human viruses, including both RNA and DNA viruses. The antiviral potential of ivermectin against various viruses is mediated through complex mechanism involving inhibition of nuclear trafficking of virus. While the treatment guidelines using ivermectin have been established in some states in India, various trials are underway in India and worldwide to establish doses and clinical efficacy. Over 100 vaccine trial is going on in the world for this novel coronavirus disease. 3 vaccine trials also going in India. However, we are not going to get any effective vaccine in 2020. So the best way to control COVID are prevention and enhance immunity. It is impossible to vaccinate 138 crore Indians in a short span of time. So immunity is the best vaccine. So continue to protect our fraternity and community. Khatra abhi tala nahi hai, dosto. Thank you very much for this wonderful attention. Thank you.
Thank you, Dr. Suryakant, for a wonderful insight on ivermectin. I have received over 200 question answers. But before I take up some of the questions, I will now invite, who is the next one, Benny?
Yes, sir.
I will invite Benny and then Dr. Pupparao to speak.
Okay, sir. Thank you, Agarwal, sir. Actually, Dr. Suryakant has wonderfully narrated the entire theory of ivermectin. Not only the ivermectin, the prevention and control of the COVID as a whole, he has discussed in detail. So nothing more to share. First of all, I am like to comment on, no viral disease is curable. No viral disease is curable. We can limit the severity of the disease, or we can limit the infectivity of the disease. That is the theory behind when we are treating a viral infection. Even measles, mumps, rubella, chickenpox, any viral disease is concerned, no viral disease is curable. So most of the slides I have prepared is presented by Dr. Suryakant. So nothing more to say. First of all, ivermectin, the scientific fact behind ivermectin, we know that ivermectin inhibit the import of, that is import of viral protein into the nucleus. That is why the mechanism acting on the antiviral effect of the ivermectin. Although being widely used for this antiparasitic properties, there is immense, there is versatile use of ivermectin in terms of antiviral and antiparasitic, even anti-cancer activities for the ivermectin. In virus is concerned, even ivermectin is proved effect on the HIV, dengue, chikungunya, JE, and so many viral disease. Ivermectin is found to be effective. We all know the mechanism already explained. That is mainly mediated by the that is IMP alpha and beta 1 mediated viral protein transport. What is the role of ivermectin in the treatment or prevention of the COVID-19? This is also explained, and in many of the in vitro studies, we have a lot of in vitro studies already happened. Most of the in vitro studies shows that there is a 5,000-fold reduction of viral load after 48 hours of use of ivermectin. That is, even within 1 day, there is a huge reduction of around 50%, and there's 90 in different doses. In 2.8 and 5 microgram doses were tested. In 2.8 dose, around 50% reduction, and 99% reduction for the 5 microgram dose. This also explains by what do you think could be the reason for selecting this drug for COVID-19 patient? Ivermectin is a versatile drug. I have already explained. It is a multi-phased agent with antimicrobial, antiviral, and anti-cancer property. Owing to the antiviral activity, ivermectin may play a role in many essential biological processes. Besides its antiparasitic and antiviral effect, the drug also causes immunomodulation in the host. There is another theory is immunomodulation. According to the international multi-center observational studies across 3 countries, a single dose of, that is 150 micrograms per kg of ivermectin decrease the fatality of COVID-19 patient. When compared with the control, there is a 21.3% mortality, but when with the ivermectin, only 7.3%. A small clinical study also showed that use of this drug in hospitalized patients with COVID-19 was associated with a lower mortality rate and a shorter hospital stay. Moreover, it is compared with the other pharmacotherapeutic options for the management of COVID-19 patient. Ivermectin may prove to have leverage over them. It is not only possesses a different mechanism of action, but also has a upper hand due to its safety profile. The mainstay is safety profile. Whatever be the drug in front of us, like hydroxychloroquine, the WHO has already ruled out that it is not useful for the treatment of COVID-19. And many drugs in front of us, it is already proved that it is not useful. When we are using the hydroxychloroquine with azithromycin, there is a more chance of QT prolongation when compared with the drug using alone. So the hydroxychloroquine combination with azithromycin is more harmful for the cardiac issues. Are there any ongoing clinical trial? That also explained by already explained. There are a lot of trials. There are around 34 trials are happening over the globe, and even now 31 are still active. These are the trials happening all over the globe. Some states like Uttar Pradesh have replaced hydroxychloroquine with ivermectin. Why do you think this step has been taken? There are a lot of questions in front of us. Why particular state has adopted and another states are not adopting such a measures in their area. Hydroxychloroquine is essential and anti-malarial drugs, while ivermectin is an antiparasitic agent, which which has been reported to be comparatively more effective for the treatment of COVID-19. Side effects are also less when compared to the hydroxychloroquine, which may cause cardiac-related ailment in the long run. Health department officials involved with COVID-19 management have stated that ivermectin is already being given to frontline health workers. These are also explained by sir in previous discussion. Should ivermectin be prescribed to people who have come in contact with COVID-19 positive patient? Some reports indicate the need for ivermectin for people who come in contact with COVID-19 positive patients. They should be advised to take 12 milligram dose of drug on the first and seventh day. And healthcare workers need to take the drug on the first, seventh, and 13th day in a month. This is the current evidence shows that. If we compare ivermectin doxycycline combination with the hydroxychloroquine azithromycin, which one is superior? Definitely, ivermectin doxycycline combination appears to be superior to the hydroxychloroquine azithromycin combination in patients with a mild to moderate COVID-19. In a study involving the patient with a mild to moderate COVID-19 tested positive for the RT-PCR, outcome of ivermectin doxycycline were compared with the hydroxychloroquine azithromycin combination. The presenting symptoms are the presenting symptoms were fever, cough, sore throat, just like the normal presentation of the COVID-19. These are regarding a combination of FDA TGA approved ivermectin zinc hydroxychloroquine has been shown positive result for COVID-19. Do you think it should be considered immediately to fight the pandemic? These three medications are already approved and do not need preclinical or clinical trials nor additional TGA approval unless the aim is to combine in a single capsule. This is when ivermectin is concerned. The last ivermectin is for the use of many diseases for the last 30 years. So there is no safety study or further studies are needed for the human safety. Some of the medical professionals are already using it as a preventive therapy themselves. The tablet can be taken at home as a preventive treatment by high-risk individual like elderly or by whose test is positive to minimize the need for hospitalization at a higher cure dose. With regard to this, WHO has also stated in a report that mass treatment with ivermectin is an underutilized public health strategy. We have to think about, because we are using different homeopathy medication for the mass treatment. We are not using a scientific medicine for the mass treatment. We have the evidence that we can use it in a better way because we are using this drug for many years. Without knowing any scientific evidence, homeopathy medicine containing different derivatives are using at a large for the public use for the prevention of the COVID. But definitely this can be considered as a drug for the public use, public health use. In case of unavailability of the plain ivermectin, can ivermectin combination be used? For example, ivermectin, albendazole. We know at current market, plain ivermectin is not available. If available, also very few. But a lot of brands with ivermectin albendazole combinations are available. Definitely, it has been suggested that the use of ivermectin will be expanded. Ivermectin might not be readily available across the state and country as it had been limited use. However, it is readily available as ivermectin albendazole combination. Based on the finding of such studies, combination of ivermectin may be considered with other drugs like doxycycline or albendazole, depending upon the condition of the patient. Though the recommendation of the plain ivermectin, but if unavailable, in many opinion, ivermectin albendazole combination can be given as a dosing schedule for the albendazole used by most if for 3 days for deworming, and same is of ivermectin in COVID. That is, in some situation we are using albendazole for continuous use for 3 days for the deworming, but we can combine with ivermectin, and we can use for continuous for 3 days. They own once daily dose for the 3 days. As in India, deworming is hardly done hardly done. Ivermectin albendazole will in fact be useful both from COVID perspective as well as deworming. This is in short. Actually, I have speed up my presentation because the time is very limited. That is why actually we are out of time. That is why I have speeded up my presentation. Thank you all.
Thank you, Dr. Bedi. And now Dr. Papparao.
Sir, most of the topic is covered. I don't have many slides for different. So I will just make few comments. One thing I am worried is about post-COVID syndrome. COVID is leaving devastation in about 20% of population, 20% of affected people, both symptomatic and asymptomatic, and of course majority in the symptomatic. And most important thing to prevent this is the first week treatment. The first week treatment, when the viral replication is rapid and when we can control the viral replication, drugs, I mean, particularly when there are no specific drug, we have to keep, discovering the new drugs. Ivermectin is one of the wonderful, revolutionary drug, I should say. It's world's first endectocide. That means it affects the endoparasites like onchocerciasis, like lymphangial filariasis, like helminths, like ascariasis, and so on, trichuris, trichura, etc. At the same time, it is highly effective on ectoparasites like pediculosis, that the lice, and on scabies as well. And it has, the beauty of this molecule is it's highly effective and least toxic. Means there are a few drugs in the world that that has made a mark with their best. What is important with every drug is efficacy and safety. Its efficacy, if you look at the efficacy, it has changed the quality of life in billions of people world over by improving the as worm infestation management. At the same time, it is part of program of elimination of two global diseases. One is onchocerciasis, other is lymphatic filariasis. It's a wonderful drug that is giving immense benefits to the human population. So I just want to make just one comment on how it works. As soon as the virus enters into the body, it takes into the host cell. It enters the cell, and with its protein, that SARS-CoV-2 protein, it just translates the protein material onto the nucleus of the host. That's how it happens. And then what happens is the complex of the protein, the host protein and the virus protein, makes a shut-off system. It shuts off the host cell so that no immune intervention in that, and also active viral replication happens. And this is the place where ivermectin acts effectively. It enters into the cell because it is hydrophilic. It can easily pass the cell membrane. It enters into the cell, and it competitively it binds to the protein on the nucleus of the host, and thus it doesn't allow the virus to get translocated onto the host nucleus. This is the most important mechanism one should understand. I think using ivermectin is important as early as possible. And mostly the devastation of post-COVID syndrome, most of that is, the brunt of that is borne by the lungs. Lungs takes a lot of, at least 10% of them are going on oxygen to home. And the second affected organ is the heart, and third is the kidney. It affects by two ways. One is thromboembolic phenomena, other is inflammation of vasculitis, arteriolitis, and capillaritis, and so on. So these are the few things we should keep in mind. And when you use some of these drugs like IL-6 inhibitors, we have to avoid we have to make sure that there is no bacterial infection or parasitic worm infestations. So for that, at least we should start early. The ivermectin albendazole combination is world over a pan-helminthic drug. So it has a combination. This combination is, very highly complemented combination. We should use at least 3 days to start with, of 2 hours after the dinner initially, and then we can start the other protocols with the ivermectin alone, because this protects from particularly strongyloidosis. The IL-6 inhibitors can cause, can inflict a lot of if the patient is suffering from strongyloidosis, and they will have very devastating effects. So we must use ivermectin at this point to eliminate any other parasitic infestations. And we should more and more understand in practice how best it works, and we should also have the data how best it prevents the post-COVID syndrome. And of course, definitely large human trials are required to, for complete utilization and the fixation of the dose and so on. I hope in the coming few months we'll get the maximum data. Thank you very much. Back to Dr. Agarwal, sir.
Thank you, Dr. Pappara. And I'll quickly, because the time is very, very, very limited.
Yes, sir.
Go to some basic rapid fire consensus statements for everybody. Though I have a list of around 200 questions which have crossed, but I will go directly into certain decisions without going into the questions because the time doesn't permit me. So I'll divide my consensus statement into two: prevention and treatment. So all three of you, let's have healthcare worker protocol. Healthcare worker today. What is the current protocol? Consensus of all three of you.
Day 1, day 7, and day 13, 3 days, 3 doses every month, as long as they have the risk.
Now, what are your day 1, day 7?
Day 1, day 7, and day 13 of every month.
So you are talking about 3 doses every month.
Yes, sir.
What about Suryakant?
Sir, we have already given our opinion, and I think Geo is already there with UP government. We have advised in that Geo also that first day, 7th day, 30th day, and then once a month.
Dr. Pappara, are you there?
Yes, sir. Yes, sir.
No, sorry, Dr.
Benny.
Benny has left. So here, so let us come back to all of you who are a healthcare worker. So IMA recommends weekly, that once in a week. And so you have 3 choices. Either you go once in a week, which is also closely to what Dr. Pappara is saying. And Dr. Suryakant is also saying the same thing. Day 1, day 7, day 30 means in the first month you take 3 or 4 drugs. So it may be still easier if you take a weekly dose for the first month. And after first month, either you can choose a weekly or a monthly. So if I want to go back to a consensus, in the first month, you take it weekly. Because Dr. Suryakant says 3 doses, Dr. Pappara also says 3 doses. We say go ahead with the 4th dose also every week. And then you have a choice, weekly or monthly, that you can choose. But coming back to the high-risk people, Dr. Suryakant, high-risk people means diabetic, hypertensive, elderly, or I would define high-risk means whose CRP is between 1 and 3. They are people with mild inflammation. For them, can they take a prophylactic dose? As on today, there are no recommendations, but what is your recommendation?
Yeah, same time, actually, I'm of the opinion that same kind of dosage schedule, which we recommend for the healthcare workers, that can also be given, that can also be expanded to, number 1, to the severely ill patient already having comorbid condition or high risk patient.
At the moment,
and they can also
about high risk. We will come back to the third category.
Yeah. High risk people, and of course those who are labeled as corona warriors. for example, media people, security people, and so many other people, they are also heavily exposed to the, of course, the COVID-19
Okay,
risk.
so all high-risk people and the healthcare providers, including the people who are in the healthcare industry. Dr. Paparao.
Yes, sir. When it comes to the elderly, there are many studies earlier were showing it is very safe above 80 plus. And in these people who can have very severe post-COVID syndromes as well, if they survive from the COVID, and this should be much helpful. And ideally, it should be 3 doses at least in a month for all the high risk, including diabetics and hypertension and heart failures.
So that's okay. 3 or 4 doesn't make a difference
Yes,
because
sir.
that's the same thing. Coming back to the close contact, I am positive my family is quarantined. So people who are quarantined, close contact, history of a contact, they are quarantining, waiting for 5 days for the symptoms to develop. Any protocol for them, same or different?
Sir, we are having a protocol of 2 doses only, the first day and 7th day.
So and that's it. So by
That's
seventh
it.
day, if you don't develop a disease, you are okay. Okay.
Yes, sir.
And is there any protocol for post-COVID? Means your COVID has gone, now you want to prevent reinfection. Is there any study anywhere which talks about prevention of reinfection?
I'm not aware of.
No study. So no study for. So as on today,
As of now, there is no clear data. At the same time,
so the one
they,
message we are
yes, sir.
finalizing it that if you are a healthcare provider or if you are dealing with the healthcare industry like Chowkidar, like people who are vendors, like healthcare providers, like media. So everybody who is visiting hospitals, we are categorizing them as a high-risk healthcare workers. So they follow the same protocol. And if you have a high-risk individual, so I go other way around. All those people who have been advised to wear a medical surgical mask or N95 mask comes into the ministry guidelines, they are high risk for me and they goes to a simple protocol and that is 3 to 4 times in the first month. And then you can carry on weekly or monthly depending upon what protocol you are following. Coming back to the treatment consensus, I'm coming back to the treatment is in the first 9 days. If the patient comes to us in the first 9 days when the virus is still replicating, in the first 9 days when the virus is still replicating, because this stops the replication of the virus, so earlier the better. So in the first 9 days, earlier the better. The protocol, Dr. Surya, is?
Actually, in UP protocol, the protocol is of combination of ivermectin and doxycycline. Ivermectin for 3 days and doxycycline for 5 days. But personally, now I feel after reviewing the literature that I think we have to extend this because, as you say, the formula of 9 is very important. So I think we have to extend either the patient become asymptomatic or till the maximum 9 days. So I think Dr. Paparao can come.
I think I agree with you, sir, in this. I think it is, absolutely safe drug, doxycycline as well as ivermectin. Ivermectin actually used as mass treatment drug in many third world countries. It just given to the school children. It just given to a vulnerable population. So it is absolutely safe drug. And we can, of course, can use up to 9 days or symptom relief, whichever is earlier.
So the
So
first
symptom relief itself is a sign of reduction of viral activity. So
one thing we have come back is in the first 9 days when the virus is replicable, give a combination of ivermectin and doxycycline.
doxycycline.
After
Or
9
minimum
days,
5 days. If the patient become asymptomatic, then minimum 5 days, or you can extend up to 9 days. That can also.
When I say that after 9 days the virus is non-replicative, at that particular moment, if a patient comes to me after 9 days, is there any justification of giving ivermectin?
If the patient is symptomatic, yes.
No, when the virus is non-replicative, because there is no evidence, even if the patient is symptomatic, that the virus is replicative, because they are developing post-COVID symptoms. So as on today, I would say no. Unless
No, sir, there is no data. Neither theoretically, there is no evidence to say that it is effective in post-COVID once the active replication is over.
Yes.
Unless we say it has an anti-inflammatory action. If we can demonstrate that this drug has an anti-inflammatory action, Then we will come back to a post-COVID phase. It will do dual effect for a post-COVID inflammation and prevention of a secondary infection.
Then I think oral steroids are better because they are established anti-inflammatory drugs.
So all
So
those
steroid-
all those colleagues who are following this program, as on today, there is no controversy as on ivermectin is concerned. There may be controversies on hydroxychloroquine. There may be controversies on remdesivir. There may be controversies of favipiravir. There may be controversies on plasma therapy. As on today, there is no controversy on ivermectin. Trials are going on. It is not that trials are not going on. This is a off-label use of ivermectin. Basically, it is a parasitic drug. It's an off-label use. And as a off-label use, if you are giving something which is safe, which is shown to be effective, and yet not proven to be not effective. So unless there is a study that this is not effective, and trials are going on, including All India Institute of Medical Sciences, we continue with our judgment today that continue giving doxycycline along with ivermectin. Number two, those who are believing in hydroxychloroquine and they want to give hydroxychloroquine, yes, it can be combined with ivermectin. Number three, those who are continuing with azithromycin, yes, azithromycin and ivermectin can be combined. There is no harm of combining azithromycin with ivermectin without any problem. Yes, there is a need of the triple drug to be added. Anyway, everybody is giving zinc. So zinc, ivermectin, doxycycline today in a debate and a consensus statement has won the first prize amongst the participants.
among the all available options. Yes, sir.
With the available references as on today, yes, you can prefer, if you prefer hydroxychloroquine and doxycycline and zinc together, you will not be criticized that you are experimenting on a person. You will say it is evidence-based. That's all for today. Let me thank all my speakers, Surya, Papa Rao, and Veni, and all of them who are here, and all my viewers, dear colleagues who are watching. Share this video with others, may help many people. Thank you very much. We'll be back with one more seminar in future. Thank you. Namaskar.
Thank you, sir. Namaskar.
नहीं, दूसरी connect